Good evening, everyone watching in, or good morning if you're watching from the American side of the world. My name is Mr.Selfcare, and we are here for yet another beautiful discussion this morning. Yeah, it's a morning my side. Today we are shedding light on a condition that affects millions of women, yet remains widely misunderstood, misdiagnosed, and often ignored. Ladies and gentlemen, we are talking about endometriosis. In Uganda and across Africa, many women continue to endure severe pain in silence, especially during, after, or before their menstruation, and often told that this pain is normal. But today, we are here to challenge that narrative. Whereas we expect that some pain during menstruation or during the menstrual cycle may be normal, not all of this pain is normal. We were here to bring light, to shed more light on a disease called endometriosis that is affecting millions of Ugandans in silence. We are hosting a group from the Endo Warriors Uganda or the Endometriosis Foundation of Uganda to have a discussion around this. And we are glad that all of them are here, all of them have tuned in, and all of them are here to share not only their experience, but also help us understand actually what it means to have endometriosis, what it means, and the challenges they have gone through. We've run this program all through the month of March, and we are glad that most of you are getting interested. Earlier on today, we had a discussion about rare diseases in Africa, and we all agreed that endometriosis is one of those rare diseases that affect less people, but those that are affected actually suffer to a greater extent. So join me as I welcome my colleagues and friends from Endometriosis Foundation Uganda for this candid and great discussion where we are going to talk about this. Let me start with Julie. Julie, good morning. How are you and how have you been?
I'm doing okay. Ever since I joined the foundation, at least I can cope up.
Okay. Okay. What do you do for a living, and where do you work? And
I work from Kampala town,
okay.
Wilson Road. I do printing, designing, photography, um, plus branding.
Okay. Beautiful. Let me go to Fina Nalukwago. I was going to call you Nalubega. You know the reason. Fina, please greet us. How are you? Okay. Yes, Fina.
Yeah, I'm all right.
Fina, I
Thank
can't
you.
hear you.
You want a brief about myself?
Grace, can you hear Fina? Okay. Fina, please continue.
Yes.
Greet us
So,
and
hi
introduce yourself
everyone.
to our viewers.
Okay, thank you so much. Good morning to you all. I'm Nalukwago Fina. I'm a nurse and an endometriosis advocate. Yes, I don't have endometriosis, but I have a sister and sisters of the Endometriosis Foundation Uganda who go through the pain and the struggles of endometriosis, from which I really became a strong advocate of endometriosis. Yes, thank you.
Okay. The big yes, Tara, can you hear me? Okay, I think Stella. Yes, Tara, can you hear me?
Hello.
Yes, Tara. Can you introduce yourself and we start this discussion?
Good evening, viewers. Is it a good morning? Good evening.
Good evening.
Good evening, viewers. I'm Stella Nakato. Yes, it is good evening. Yes, Stella Nakato is my name. I'm an endo warrior.
Okay, beautiful. And then the big boss, Grace, can you greet our viewers and we start? Uh, Grace, you seem to be muted. Yes.
Good evening to our dear viewers. My name is Grace Nagawa. I'm the CEO of Endometriosis Foundation Uganda and Pan-African Holistic Endometriosis Wellness Organization. Humbled to be here, and thank you, Richard, for the invite.
Okay. Let me start with Fina. Fina.
Yes, please.
To someone that is new to this program, what do you exactly mean by endometriosis? And why is it commonly misunderstood? What, to someone that is new to this program, what is endometriosis and why is it commonly misunderstood?
Okay, thank you so much for that. To someone who is new here, so endometriosis.
Uh, Fina, I'm struggling with your network. Okay. Okay. Yes, Stella. Okay, I'm struggling with network. Yes, Julie. Yes, Grace. Let's start here. To someone that is joining us for the very first time today, what do you normally mean by endometriosis and why is it mainly misunderstood today? You're muted. Okay.
Endometriosis is a chronic disease where the tissue similar to the lining of the uterus, we can say the inner lining of the uterus, grows outside the normal uterine cavity. Yeah, a woman has uterus, the woman's uterus has three layers, the inner lining that bleeds during menstruation, the middle layer and the outer layer. So the inner lining, which is called the endometrium, it has normal cells. So once it moves outside the normal uterine cavity, that is what we call endometriosis. And adenomyosis is when that inner lining, instead of moving outside, it moves into the middle of the uterus through the myometrium, that middle layer. So when it eats up your uterus, that is adenomyosis advancing. Yes. Yeah. So those people, those young girls with chronic period pain, that would be one of the typical signs, one of the key signs that one would have endometriosis. Yeah.
Julie, can you hear me? Okay. Julie, can you hear me?
Yes, I can hear you.
Okay. Julie, take us through your story. What did you experience? What symptoms and signs did you have when by the time they told you you had endometriosis?
First and foremost, uh, I was healthy. I had no any complication in my life, but
Mm.
the signs started after my Form 6.
Mm.
My periods were normal and everything was so normal. But the signs started after my Form 6 when I had some kind of pain. It was not so hard, but it was on my lower abdomen. So I went in the hospital. They told me I have infection. So I was treated infection. But now the next month, this pain is coming back. In my head, I thought maybe it is infection because I used to work in town. The toilets in town, they are not so clean. So I thought it is infection. But then this weird pain continued to come every month. So I asked myself, so the infection is coming every month? What's wrong? Because I used to take precautions. The doctor, they are telling me how to avoid infection and everything. So it was not possible for me to be having infections every month. So the next month, the same pain came. But every month, this pain is keeping on increasing, and it's on one side now. It's no longer the lower abdomen, but now it's on one side. It's where I'm feeling that sharp pain. So I went into to the hospital. They told me, so for me, I thought it is infection. But they checked me, I didn't have infection. But now I told them, now what's the problem? So they told me maybe I have it's called kabotongo. They told me I have kabotongo. They treated it. Um, they treated it. The pain used to respond to the medication. I don't know why, but the next month after every period, I could get severe pain. Now this pain is increasing terribly every month and on my one side of the ovary. So the pain kept on increasing every month. It took me a year. They recommended me to go to the big hospitals. I went to Mengo. I did the scan. They told me I have ovarian cyst. Yeah, and they told me they are going to treat it. Sadly, I took the medication for 3 months. Yeah, the pain was not reducing, even though I was on medication. So I asked myself, what's wrong with me? I used to do different scans when I was on my medication, and the last scan I did on that last month, there is a doctor came into the room where I was taking my scan, and the doctor told me, this looks to be endometriosis. So I could not even get that word in my head. I just left it there. For me, I told in my mind, I was like, no, 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 no. I can't have such a thing. Even I can't pronounce the word because the word was very long and very difficult. I was like, no, 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 I don't have. So this doctor was like, you have chocolate cyst. So I went to the doctor. He told me, you know what, you have had the medication. Now what is going to heal you? It is you need to be operated. By then I didn't have the money because I used to spend a lot of money before even getting diagnosed in big hospitals in form of infection. I used to leave there a lot of money. So I just went home. I told my parents. For them, they told me, let us use herbal. Because even that word was very wrong, endometriosis. And it is not even common. It is not common. And even you cannot even explain it very well to my local relatives. Like, what are you going to tell them? Because for them, at least they understand fibroids. They can understand fibroids. Now, what am I going to explain? That the tissue which is supposed to be in the uterus, now it has gone this side. how am I going to explain that in my local language? So it was very, very difficult, and the situation was really devastating. It was not really a good situation, very stressful, confused, very fearful. When I heard about endometriosis, I went to Google. I tried to Google where can I find is it there. For me, I used to see white people. I was like, what? So I'm having this disease even for rich people. Eh? But my parents were like, let us try. Oh, we tried all kind of herbs, but the pain was there. It was not reducing. It was terrible, and it was increasing every month. And by the way, and that period in that pain I was having, even my periods changed totally. They are not normal as they used to be. So we tried the herbs, and some relatives were like, oh, maybe you were bewitched, this pain we can't understand. So it was very tough. It was very tough, like it was very rare. The pain continued to be so hard. So I chose, after trying out the herbs, I was tired of the pain. I'm not finding any person with the same kind of thing. I thought maybe I'm a different person, maybe I'm cursed, because it was really totally different from other forms of diseases. So after prolonged pain, I was really tired. Yes, I feared the theater, but for me, I wanted to be free from pain. That's all I wanted. So I went to the doctor. I said, "What? Let us have the surgery." We proceeded to the surgery. But what did this doctor did? Just opened up and then closed, and gave us the result that this one was not possible because the cells, there are those uh, medical writings I could not understand properly. But he gave us something which we took to the laboratory, and they confirmed it was endometriosis gland. So that's when I proved that I have endometriosis. So after the surgery, the pain was still there because I had not got the proper surgery as it's supposed to be. Because even the doctors were not yet informed about this disease. Because for him, he thought it is just ovarian cyst. It is just ovarian cyst. Yeah, it was not maybe endometriosis. So I found out that I have endometriosis after testing that person he removed from me. But the pain remained there. So I went on social media. I wrote to some groups where there are many women, if there is anyone having the same condition that I had gone through. That's where I got some recommendation to go to Henrob to see the late Dr. Spire. Sadly, he died. That's when I went there. I talked to him. He was like, you need to have laparoscopy. But by then I did not have money for laparoscopy because I had really spent much of the money for like 3 years spending money. It was very expensive because I used to take even supplements, which are very expensive. You know, when you are sick and you want to find a solution, like you can go with anything you find online. Like there are many things they sell online. They put there, it cures endometriosis. You buy, but at the end you don't get any solution. So when I went to the late Dr. Spire, he told me you have a laparoscopy, but I did not have the money. I just moved out. I just moved out crying, very confused, very fearful. It was not so easy. It was not so easy. Right now I'm strong, but back then it was very, very tough. I think I got the strength after joining the foundation. The first day I had someone talking about endometriosis. It was a YouTube, and she was a Ugandan talking about endometriosis. It's someone else talking about endometriosis, and is a Ugandan, a black one. It was a miracle for me, because for me I thought I'm alone. I I'm alone, because I used to search. I could only see white. I could only see white. But hearing her talking about it, it was a miracle for me. I was like, I got a sister. So after there and then, I inboxed her on her Instagram. That's where she recommended me to join the organization, the Endo organization. When I joined them, I found like I have got a family. Like it was like I have got my life back. Because by then I thought I'm fighting alone and fighting something I don't know. At some point, I was like, maybe I was born to be like this. Maybe I'm bewitched, something like that. Because you're treating something which is not even reducing in pain. Even the doctors, they are failing. What they are giving you,
Uh,
it's a painkiller, and
Julie, sorry to cut you short. Let me get this right. Julie, are you still there? Okay, I think I've unfortunately lost Julie, but she's going to be back with her story. Stella, can you hear me?
Yes, please.
Stella, tell us your story about endometriosis. How did you get, I'm not going to ask how did you get, when did you know you had endometriosis? Tell us your story between when you started seeing those symptoms to the point you joined Endometriosis Foundation of Uganda. Tell us your journey the public wants to hear this story, because there is something I've heard that is actually very painful. And after here, I'll come to Fina, who is an advocate of endometriosis, to answer me the questions. Number one, the good thing, Fina is also a medical worker. Why do you normally misdiagnose this? Why is it hard to confirm that someone has that? And why do we have medical practitioners continue to do wrong surgeries on so many people? Because this is a story that I've heard so many times on people who are having endometriosis. From Julie's story, we hear she had the surgery, opened up, and they couldn't solve the problem and closed her up. Imagine that kind of pain. Now, these are professional people who charged her highly of the little money she had, opened her up, and closed her up without solving a problem. That's why actually when such diseases come up, I'm very open to hosting those conversations, because a lot of people are suffering. To the men listening in, to the parents listening in, imagine this is your daughter. You have to sell your goats, your cows, to make sure that she gets a surgery. Then you go to a medical practitioner, they open her up, only to discover the wrong surgery has been done. We all need to stand up. These are rare diseases, but like I said, the few people who go through, who are suffering these diseases, actually are suffering too much. Yes, Stella, tell us your story about endometriosis.
Yes. I think earlier before I never knew, because I started my piece, but painful periods. Like from the word go, I began with severe pain, and I could miss sometimes, and I would take it like, now I'm fine, I've missed. And whenever I could miss, I would feel very free. But then I was going through severe pain from the word go. Then I kept on going to different hospitals, but then they were telling me infections. Until after a long period of time, because I began in senior 1, then in my vacation in senior 6, I got somewhere at my auntie's place where I was working. But then I was near a sensible hospital called Doctors Plaza Kabalagala. So I met a certain gynecologist called Dr. Gilbert. I kept on going to him, asking him what could be the problem. But then he could rule out that it is what? UTI, PID, whatever. But then what came into his mind is after him putting on me different medications, but then they failed to work. After failing to work, they had to do what we call culture and sensitivity. Then they had to give us another option that I was supposed to use. But then we used the medication, the medicines they had prescribed down, but still they failed to work. I was going through severe pain, collapsing, feeling numbness, like I could collapse to get up when 4 days have passed. Then he was like, I think we need to open and see what could be the problem, because this pain, we don't know the root cause of this pain. But he said you need to do a laparoscopy. But then me as Dr. Gilbert, I don't know it. I'm going to introduce you to my friend, and that was Dr. Musana. But then I have to take you to Nsambia Hospital. So he took me to Nsambia. We did the laparoscopy. Dr. Musana had to do a laparoscopy. But then after opening, for him, he opened and said, I can only diagnose, but I can't do anything. That's where I found grace. I think I found grace on my surgery. Yes, I think it was the surgery that was done by Dr. Romano. Then they called her that, there is someone of the same disease. But then to rule out, I had more of adenomyosis, and it has already affected my entire organs. I was already in stage 4. That's how I found grace. Way back in 2015, May. And I've been battling with that disease. I've gone through 5 surgeries, and the 5th surgery seemed to be successful, but then the situation has worsened.
Stella, did you say
Yes,
you've undergone 6 surgeries for this
yes,
condition so far, and
yes.
the solution is not yet found?
What they are telling me right now is so complicated, because I've just gone through this severe surgery, very expensive, around 20 million shillings. You can't imagine. You don't have your biological parents. People are just helping you out. And whatever they are investing, they are not getting a permanent solution. They're not getting a permanent solution. And medical doctors who are seeming to be understanding the condition, they can't tell us the real truth. And one thing I've realized, like, I've moved to different hospitals looking for different opinions, but then they do what we call, I think they contradict each other. This one says this one says this one says this. So the person who had come out, the last surgery I got, he was telling me they have done wrong surgeries. And then my sister had to ask him, now this surgery that you're going to do, will it rule out the entire story? Because we've been moving from hospital to hospital. Only one doctor I found, and that is Professor Chikampi Kaho from Kololo. That man told me this disease is not known to Ugandan gynecologists, only those who have gone outside and maybe they have attained the entire training from that side. But here in Uganda, it is so complicated. And he advised me to look for the youngest gynecologists who have gone abroad. That's how I found the late Dr. Spire Chigund, still through Miss Grace. And then another thing that helped me to find out, it was, as I was in surgery, we had the surgery in the same year with Miss Grace. But then for her, she was taken out of Uganda. That's how she came out with the information. I've been moving with her. sharing the same information and moving hand in hand. Then when you got Dr. Spy, I thought that things will be very fine, but unfortunately, the system has gone down. Right now, what they want to do, it is very expensive and very confusing, of which I don't even know. I don't know, I can't say that it will rule out the entire story.
If
Yes.
you're watching this program and you're not moved by the stories you're hearing, there should be a problem with your body system. We are talking about the women you're seeing here are not, I don't know the word to use. Normally when we see these diseases, we want to blame them. Maybe their parents didn't do this. Maybe they are careful. Maybe they have done abortions. Maybe this. The women you're seeing on the screen, most of them have not even had a child, a biological child.
And we
The
don't
women
even
you
have hopes.
the women you're seeing here do not even have hopes of ever having a biological child. The women you're seeing here, each of them has gone through a surgery to try to correct the problem. Julie said she was opened up. They did a laparoscopy. Opened up. They closed up and they said, oh, we can't do anything about it. Her money was taken. Stella has spent more than 20 million Ugandan shillings. That is on surgeries alone, minus drugs, minus transportation, minus labs and everything. She has gone through more than 5
And that was
surgeries.
only the last surgery. Yes. And they also opened me the very first, and they had to come in the group of very many doctors discussing about me. Do you know this stigma that you can get? They called me, they told me you're supposed to come with someone who is 50 years and above, someone who is financially stable. They put me in a certain room. They called very many doctors and they were discussing about me, portraying the entire picture of me inside my whatever they had done inside. They were discussing things that I never even had control. I couldn't even suggest anything. I never knew what to say. I never knew what to do. I never knew what to answer. I just looked at them because I never had the money. I never knew what to do. I never knew what to say. So green about everything that they were discussing. And each was contradicting each other. This one says this. Moreover, as we go to hospitals, thinking that they have the better management. But then you go there, they're discussing about you, but you as an individual, you don't know what to say. And even themselves, they are contradicting each other. This one says this, the other one says this. This one says this one says no. Then you look so stupid before them. And you just get out of the room without a conclusion.
Earlier today, Sunday morning, I had a discussion with the president of rare diseases. And this is exactly what we are talking about, that these diseases do not affect so many people, but those who are affected are going through immense pain. They are dehumanized because people think, some of them actually think it's witchcraft. This is the magnitude at which some people are looking at the people you're seeing on the screen. They are not here because they don't have time. They're not here because they want to show off. These are Ugandans that are paying taxes. These are Ugandans that are paying deeply for a disease they are not responsible for. To someone watching, these people didn't do anything wrong to deserve what they are going through. I knew this could have come later, but let me say, to the government of Uganda, why should we continue to have women going through this immense pain? To the Gynecology Society of Uganda, this is a gynecology complication. When do we come to look up for cases of people who actually open up people without actually clear diagnosis and at the end of the day charge them and simply walk away? close them up, and walk away. To friends, families watching in, this could be your daughter. Your beautiful daughter in the house who has not started going for periods right now, who looks normal, at age 13 or 12 could turn out to be one of the victims or one of the survivors of endometriosis. The question is, what are you doing about it before before it enters into your own house? This could be your wife going for normal surgery, and that tissue is accidentally moved from the endometrium to another part, maybe the ovaries, when they are closing up. If tomorrow you wake up to women listening into me and you have endometriosis, how would you love us, the society, to treat you? It takes us who do not have the condition to shout, to come and advocate for people who have this condition, because they are few in number, but telling you they are suffering greatly. Stella here has had 6 surgeries, costing her a lot of money that is fundraised by friends, people that are not her family members, and she has not gotten a solution. Julie earlier said she was opened up, paid the money, went through all that recovery healing process, and told the problem is not solved. The story of Grace is not any different for people that have watched her speak here 2 times before. Grace, for people who are watching for the first time, in a nutshell, tell us your story. And then here we'll go to Fina, who is an advocate, for a few questions. Yes, Grace, in less than 4 minutes, I want you to summarize your story for someone watching and for people to know that we are not here to pass time, but rather to throw more light about things where majority of people are suffering.
Yeah, thank you so much. In brief, I've lived with endometriosis for now 23 years, since the age of 14. My first surgery was in 2017. I grew up in pain since 14 years, bleeding for 3 weeks. Never with a clear diagnosis. I was being treated for UTIs, PID, and all that. So not until I clocked 27 years that I got a clear diagnosis, and it was already stage 4 endometriosis. So all my ovaries were eaten up, the bowel, the intestines had a disease, and the peritoneum had endo. So yeah, the first surgery, I was opened and closed and told that I will never get cured, and the only option was to remove my uterus. That was at the age of 27. Yes, I thank God that it was by His grace that I was able to have my second surgery in Nairobi that took us over 30 million. Very expensive, and I couldn't believe I would afford that, but it was God that provided. And that's when we came up with Endometriosis Foundation Uganda. I joined nursing just to find out what the problem was, because I couldn't find a diagnosis. But even with that training, I was never taught about endo. So after my last surgery, I would say, that was 2018, at the age of 28, I was trained about the therapies that we go through, the therapies that help us live a better life. I was managed by a professor in endometriosis who told me that he couldn't cure me. Yes, my ovaries were badly affected, that I couldn't manage to have a child up to date. But I decided to come up with a Endometriosis Foundation Uganda and to support fellow women battling this condition. Because I also couldn't know anyone with a disease. And when I looked to the many hospitals, the dear health workers, like how many times do these young girls come in hospitals? At times, we don't blame our health workers because they are not trained. We were never trained about endometriosis. Many times, these girls would come to hospital collapsed, and someone maybe says those are convulsion disorder, some diagnose a hysteria and all that. But these ladies have endometriosis, and we medics are not aware. I realize that the disease keeps progressing because even the frontline health workers are not informed. Yes, I can say I'm not healed, but much better. 7 years down the road, I'm not on any painkiller. Just sometimes we do take supplements, but managing with diet, lifestyle, and exercise, managing stress. And this is what we train our dear sisters. The support group has over 300 ladies. Yes, it is our appeal to our lovely government. We thank the Ministry of Health that is really coming up to give us a hand, to support us in raising awareness. And to our professionals, the dear gynecologists, we believe we can train. We won't love it, like having 4 gynecologists, let me say, in the country that can handle this. We have over 2.8 million women battling endometriosis. According to the awareness that we've had and the outreaches we make in schools, you realize that in Uganda, it's almost 1 in 7 women have this problem. I believe when we work together as a community, as the country, these, like, sometimes you hear the ladies speak the way they are speaking, like the way you've heard, just because we go through hell. It's not easy for a woman, for a young girl to grow up and you can't have a child. It's also a stigma, but we accept the way life comes and we support each other. And we know that, yes, we are not able to have children because it's very expensive. You battle the journey of endometriosis and then infertility. Not every woman will really afford the fertility journey. And to us, in most cases, IVF is really hard. And someone has to opt for surrogacy, which most of our ladies will say, Grace, let's forget about children. So that's why we are coming up to support our ladies in Africa. And that's how we came up with a Pan-African Holistic Endometriosis Wellness Organization to support our sisters in Africa. Many are calling out, reaching out for support. And basically, I think that's what I can say.
Fina, glad to have you here. I was supposed to have talked to you earlier, but we were let down by network. Fina, what do you do? Are you yourself also having, are you an endo warrior as well?
No, I'm actually a nurse.
Yes.
And I'm just an endometriosis advocate, but I don't have endometriosis.
Fina, from your experience, me and you are health workers. Why is it hard for us to have to come up with a proper diagnosis about endometriosis? You've heard a story of these women. Between the 3 of them, they are close to 15 failed surgeries, costing more than, I think, a total of more than 50 million between the 3 of them. Why is it hard for us to have proper diagnosis before even we go into these surgeries?
Yeah, first of all, I would attach it to the similarity of the signs and symptoms of endometriosis to other conditions. Because when you realize it's the common signs of endometriosis and symptoms, we have like pain during or after or even before the menstrual periods. We have backache, we have pelvic pain.
Fina, for some reason, I keep getting echo. I get echo from your side. I don't know where the problem is coming from. I don't know where the echo is coming from. Can you try to speak now? Do you have any near gadgets close to you? Or a YouTube video playing around you that you may need to disconnect? Okay, try connecting again, please. Yes, Grace, okay. Okay. Maybe let me come to Stella first. Yes, Stella.
Yes, sir.
You've told us your story. You've told us you've done 6 surgeries. All of them have failed. You told us you spent more than 20 million just on the last surgery alone. How did
The
you
last
come to
surgery alone,
how did you
the last,
how did
the last, hmm.
how did you come to know about Endometriosis Foundation of Uganda, and how has your story changed?
Okay. To me, I got to know Miss Grace way back when she was still in school, because she was in Zambia and I was getting the surgeries from Zambia. So along the way, when I was in theater, a certain reverend sister called her and was telling her about me. Then that's how I got to know her, and we became friends, suffering the same complication, going through the same situation, so we could share. I kept on sharing with her every now and then. And then the other part of it, for her, she had a chance of moving out of the country. So she came back with another knowledge different from these doctors that I was using. So she could give me the knowledge. That is how, but it was way back in 2015. Only that we never had the money. I wish if we had the money by that time, I would have gone to where she had gone, but I didn't go. I remained in the country and I was using the gains in the country. So I think the other side, there's the way they do train you on how to be with this complication and how to go about it without the medication. So the only good thing, she has a good heart and a very big heart. She had to share with us. We began when we were 2, and along the way we got other endo warriors, so she could share. But then because I didn't like me, I wasn't getting the right surgery. I kept on getting the same complications. Things didn't turn out well. And by the time I was diagnosed by Dr. Musana, that was 2015, May, I was already in stage 4. The things had failed, not because I wasn't going to the medical workers. And the very funny part of it, I was going to the gynecologists, not these other doctors. But then I was going to the gynecologist, where you pay your consultation fee, thinking you're getting the right person, thinking you're going to get the right medication, thinking that you're getting the right opinions. But then, to make the matters worse, things went wrong. But then she keeps on teaching us every now and then, because like after that training, let me say it was a training, because that professor, I think, took time to teach her. And what she taught her, she came back and started teaching us. Now we are supposed to practice whatever she was being taught to get the relief. But
Yeah.
then the organs were already damaged.
Stella.
So the thing
Stella.
is,
Stella.
yes,
To a young girl or to a woman listening in there that could
I'm
be
getting you, sir.
yeah, to a young girl or a woman listening in right now that could be dealing with some signs and symptoms but are not clear. What are some of the symptoms that you as Stella experienced with this endometriosis? Because it's like it is a range. What did you as Stella experience?
Painful periods.
Mm.
Sometimes I do miss. I used to miss, but then I think, because I was already in stage 4, that's why the pain doesn't go. Mine is there every now and then. There's that one
Mm.
that I can,
Mm.
let me say, I can hold, I can sustain, but there is when it worsened. There's sometimes when it worsens, I can't contain the pain. But then I keep on practicing the diet, the exercise, and knowing it is part of me, accepting. You reach a certain point and you accept. Without those other words, people can tell you words that can hurt you. But then you distance yourself from negative people. And I do focus. Whatever condition that I go through, whatever thing that I go through that I don't understand, what I do, I always ask Miss Grace. Because I go to the hospitals, they can't even tell you what to do. The best they can do is to put you on hormones. And those hormones are very expensive. Very expensive.
Wow.
You can't work because right now I'm not working. I'm not working just because of bleeding. I was told, go home, get healed, you will come back and work. But when will I get healed and I go back and work? I can't work. I don't have the money to figure out the medical bills. I'm supposed to depend on people, which is very hard. In the situation when you don't have, let me say, your biological parents, like you're supposed to lean on people, it is very hard. You can't keep on complaining. Someone can help you, like giving you a job, but you cannot be sustained because you're in and out of the hospital every now and then. You can't do hard work. Me, I can't do those things of lifting, what, because of the damages I have. And the people, actually, let me say the relatives, they ask me those funny questions that I can't even answer. Why are you not doing this? Why can't I just tell them people I cannot.
Grace, sorry, it is Nagawa. I don't know if you can text Julie and Fina to connect back. Grace, let's talk about something that you talked about that really touched my heart. That was being in a medical room and you have so many people come to discuss about you, but they are not even involving you. You even don't know what they are talking about. They are mentioning terms that you don't. Let's talk about stigma.
That was me exactly.
Why?
Over 250 doctors.
Why? How do you feel that you have a condition? How has that mentally affected you? That you have a condition where people come and mention words you don't know, talk about you. They even don't involve you in whatever, but rather come up with like treating you like a robot. How has that affected you mentally as a person? Yes,
Me
Stella.
as Stella, it really affected me. It affected me in this way. Remember, actually I was supposed to, if I had my biological mother, I think I was supposed to go with my mother, but I never had. What I did, I went with my boss. When I went with my boss, he looked at those doctors, he looked at me, he told me, you have no help. Because we needed at least a conclusion of what we can do, but then we were basing on them, thinking that we were going to get the help from them, but we didn't get. So we started moving all over Kampala, hospital to hospital, but then we are not getting a solution. And the only thing I can say, my savior is how God made it, and Miss Grace had to go out. At least she came with other ideas from somewhere else, but us. And remember, I was already in stage 4. Everything was already messed up. And what pains me most, the stigma I have, is that whatever money I was getting, I was spending it on my medication. And remember, the money couldn't figure out the medication. So I was supposed to be helped by the relatives, and of which they reached a certain point and got fed up. They're like, actually, one of them mentioned, we are treating you, you're not getting healed, and you're not dying. What else do you want us to do for you, Stella? The question up to now pains me. I feel a lot of pain. I'm like, God. Now, how about those other sisters who are outside Kampala who cannot even access these, the ones we think that at least they know, however much you are not being worked on? Do not think that everyone has the internet, everyone has a smartphone, everyone can access a TV. But then how about those ones who are in far districts? Even us who are in Kampala, we are still battling with the same thing. The medication itself is very expensive. The hormones are very expensive. Whatever you're supposed to do, it is very expensive. Even the diet itself, you being on, let me say, on the diet, and remember, you're not working. It is very hard for a mature person to be fed every now and then. You're supposed at least to earn something. It is hard to explain to people. You're not being able to work and earn your living. It's hard, very hard. It is hard to convince people.
Stella,
It's so
thank you.
painful.
Stella, thank you so much for sharing this story. And to friends and colleagues watching in, normally when I come with these stories, how I come with them, and then when I come to support, normally when I send you messages to tune in, I think most of you don't understand why I'm always passionate when I'm talking about such conditions. What you're hearing here is not story. These are not movies. This is not Katandi Kabutandi so jingo like things you see in movies. These are real life stories happening to Ugandans. These are your neighbors in your community that you see every Sunday to say good morning. These are what they are going through inside their houses. And this is one reason why we started this channel, to come and hear these hand-hard stories, to talk about such conditions. Maybe 1,000 people have not had endometriosis, but I'm telling you, those that those that have it are suffering. To government of Uganda, where are you? Why are these people continuously suffering with buying drugs for a condition they were born with? When do we come in? Okay, it is okay for them to know maybe this will never go away. But it is another thing if they have to spend money to continue buying the hormones, the drugs that they can use to have some relief.
And
Minister of
even the
Health.
insurance companies do not allow. Insurance companies do not allow hormones. You can't use an insurance to get an hormone.
I'm going again to host actual friends from insurance companies here. There are so many questions that are coming when it comes to insurance packages in Uganda. It's like it's a crook of thieves stealing money, hiding behind insurance. Because why don't government force such to come and cover such costs? Because who is to blame for something that I was born with? We've recognized people with disabilities. There are disability funds. What about people whose disability is not seen like endometriosis? Because I would consider that a disability, especially when it comes to reproduction.
It is not even
Can
reproduction alone.
we stand up for these people? I've not yet talked about what the trauma they are having when it comes to relationships. Because I
It
trust you.
is so bad.
Trust me, that is another story. I doubt how many men out there can stay and sustain such a woman. But this is something that you are born without. This is someone that you, your daughter in the house that you love, that daughter you call Nyunyu, baby, boo boo, can wake up to have such a condition. Will you love the future husband to chase her away the way you're chasing out these women simply because you found out they have endometriosis? Or you think you're so smart that it can't happen to your own daughter? Can we be more human? Yes, Nalukwago. I think I can. I hope this time. Yes, Afina. Can you hear me now?
Yes, I've tried to change a gadget. Sorry about my network. Is it better now?
Beautiful. You're loud and clear this time. Fina, let's talk about that. I'm pointing out so many things in your direction as a medical profession. Number one, there is stigma. There is stigma, and the stigma I'm hearing actually, first of all, is coming from the medical workers themselves. Stella here saying had a group of more than 100 people around her. No one is involving her, but discussing her condition. She felt she was used like a robot. Number two, we are talking about more than 20 surgeries between these four women that appeared on this panel today, where you've opened them up, closed them, not you particularly, but actually, I'm now not even talking about lay doctors. I'm talking about gynecologists, opening them, closing them up. Why don't we do due diligence before even opening them up? We are talking about more than 50 million spent on useless surgeries, like I'll call them, where you open them. Stella alone has gone through 6 surgeries. On the last one, spending more than 20 millions with no solution. We are talking about increased cost for hormone drugs. Fina, where have we gone wrong? Why do we still have a gap in diagnosis, treatment, and management? And number 2, what do you say about medics that don't care about how these patients are feeling, even when we are talking about their condition, even when we are trying to help them? Start there, from there.
Okay, about misdiagnosis of endometriosis, I would attach it mostly to the fact that this condition is not really taught in medical schools, be it nursing, the doctors, the sonographers, radiographers. We are all not taught really about endometriosis. When I was studying my nursing, I remember the basic 2 things that we were told about endometriosis is the description and a few signs of the condition. And basically, that was it. So I'm imagining a nurse who looks at a patient who has similar signs, because endometriosis has lots of similar signs with other conditions like the pain, the pelvic pain, the diarrhea in periods, the backache, the heavy bleeding. So someone would the cysts that they really get. So when a person looks at that patient, they will easily think it's another different condition because they really don't know about endometriosis. That is why most of them, I would say 99% of the ladies will be told you have UTIs and they will treat them for years, like 5 years, 7 years. You have PID, and some are actually being told you're trying to abort. Yeah, one sad story is that I have a sister who has endometriosis, and I really witnessed the pain and the struggles she went through. And one of the touching things that she always says is that there's a time she really fainted and she was taken to hospital. And when they reached there and were telling the doctors, trying to rush her and everything, the doctor was like, that one, you take her to the other side. She's trying to abort because she was bleeding too much. Like you really get heavy bleeding. Yeah. And the doctor was like, no, 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 that one is aborting. You take her the other side and work on her. So literally, it's really disturbing. And then the other side of the medical workers say the doctors, the question you asked about why would they open and then close without really doing nothing. I would say at some point that is okay, it is not really good on the side of the endometriosis patient, but the doctors probably do the right thing. Because if you open and you tamper with endometriosis and you don't know what you're causing, you're going to worsen this whole thing 100 times. And so if a doctor opens and they don't really work on the client, it's a bit safe than just working on you yet they don't know. In Uganda, the doctors that know how to manage endometriosis have trained from outside. The doctors that know how to train endometriosis, and to the most of them that are just here from medical school in Uganda and then they do the medicine, they're not really so good and like so good at treating endometriosis. One other thing that I could say about that same issue is that one of the causes of endometriosis, because you can get endometriosis as you grow up, some things can expose you to getting this condition. And one of those things is cesarean section. If a doctor does a cesarean section and in the process of cutting or suturing, like after the procedure or during the procedure, they try that lining inside the uterus happens to go outside, you can easily get endometriosis. So at some point, I would really put the cause to the less knowledge about it. So that is what is causing all that trauma, delay in diagnosis, and everything. Yeah.
Wow, this is beautiful and very, very summarized. You see, so it kind of clears the narrative that actually sometimes this surgery, sometimes the doctors open because they think it is another thing, but on opening they realize it is endometriosis and they don't want to temper it before properly. I think this gives some relief to Stella here, who's been opened so many times because sometimes I tell my fellow colleagues that if you don't take, if a patient leaves your office minus knowing fully what you've done and what they need to do, then they go worried. But if you sit them down and explain the way Fina is explaining to us right now, I think you kind of make them feel okay. And to you, this amazing team, I want us to agree to continue this discussion next week on Sunday, because I think we're supposed to deal with a number of questions that were raised in the build up to this, but we've only tackled a few, and yet we need we need to help the public. I'm telling you, most of you have dealt with a gynecologist. These are the top notch. Now imagine a small girl, like I'm a village boy born in Ikatente, Nachisunga. I love that village. Now imagine a girl there who is struggling to get menstrual pads, but has a period like a condition like endometriosis. Just imagine what what those nurses on the village have told her. It seems you aborted. It seems your mother didn't do something right. Maybe your hygiene is not good, and things like that. So I want you people to stand up. I want you to feel proud. I want you to stand in the gap to make sure. I want to dedicate this channel to Endometriosis Foundation Uganda, and I want you to host you as many times as you have people to appear here. I want us to pass this knowledge until every nurse. I'm going to tag this video into the gynecology space. I want them to know that it is not enough to have gynecologists that only know how to remove babies and remove fibroids. We need gynecologists to go back to school and specialize in such cases. Because, I mean, whether we like it or not, they should be our first time responders. I'm going to make noise. I know colleagues in ministry spaces, especially those in reproductive health, they should come on board. We should declare this as a disease that is in urgent need for help. I'm personally a medical imaging expert and a sonographer. I'm going to pin this in we have a page that connects all the sonographers. Because to sonographers watching in, how many times have you even thought of a diagnosis of endometriosis? But you see these women every day. How many of you have told these women they have the findings of a normal pelvic scan? How many of you have told these women because maybe they took one family planning pill 10 years back, and you keep telling them the problem they're having is because they took that pill 10 years back? So, Julie, are you there? Julie, do I have you? Okay, I want to have you in the camera. I have a question for you. Let me go back to the CEO, Executive Director. First of all, CEO, thank you so much for reaching out to me to make this. I am so proud of you, and you know, we love you at Selfcare Initiative. I mean, we love people that come to speak up about, and so to me, you're my warrior. To me, if I was giving heroes medals in Uganda this year, you're one of the girls, and that I would give. You've really stood up for. I remember the first time you came in my inbox and said, there is a condition I want us to talk about. You even scared. I don't know. I also want to thank Solomon Nakato who connected me to you. Grace, you seem to sound with a lot of strength and energy. How have you been able to cope up with the stigma? I remember a story you told me where I used to collapse in a choir. And come to remember, I think you used to go to Watoto Church. I think I've met you at Watoto Church. I was always clearing my mind where I could have seen. I think we've gone to the same church before. So, and you also have a colleague watching in called Flavia, who said, that is my old friend. We used to be tight. Flavia is my friend, and she's watching in and very excited. How have you dealt with the stigma? That now you appear on national TVs. I was proud seeing you on TVs talking about endometriosis. Where do you get the courage? How have you dealt with the stigma? And how have you used it to now become more proud more strong that even now will correct a group of women suffering from the same and coming up with the idea of forming this Endometrial Foundation of Uganda. Talk about stigma and how you've managed to deal with it.
Yeah. So the first thing I should say, I'm a believer, and the faith I have in God, I really feel with Him everything is possible, and I gave all my hope to God. And I believe that's why I'm really standing, and the strength I feel I get it from the grace of God. And then the gift of my family. We are a family of 9. We are 9 children. With our mom, our dad passed on. So they have been so supportive ever since they got to know I had this disease. So they would strengthen me, and they would used to tell me I will never suffer alone. They have supported me. And they don't only support me, they also support and give a hand to the dear endo warriors we support. Like many times, we are many, and many have different needs. So there are moments when maybe someone is going through an issue, they need financial support and all that, and I'll have to call everybody in the family, please, so they have been so supportive. So that alone gives me the strength. And the fact that I came to accept. And my dream, my vision is trying to make sure that no young girl or woman will stay in a shadow of this disease without knowing it exists. So I believe I have to get to that. We have to get to that moment that every woman in the country, in Africa, shouldn't suffer alone and get to access the key treatment, the right diagnosis, and to see that our fellow health workers can easily, because you can diagnose this problem just through the key symptoms someone has. You can easily tell. And I believe we shall get there. So the strength is mostly from the grace of God, because I believe even my healing is through that. Yes, I remember one day, and when I say the grace of God, because when you see media, you've talked about that, different media handles, the televisions. Personally, I can't say I pay much. Maybe I pay. Sometimes I don't even put in anything, but those people have granted us the help. They have amplified our voice. So all that is the grace of God, I can say. Yeah. And I feel I have to stand. I feel, because, when I had my last surgery, I was like, God has given me another chance to live. And that is where I stand and feel we should speak about this. And let me just use the time I have, the years I have. Yes, someone has asked, so you mean endometriosis doesn't go away? For sure, this is a chronic disease that even when you've had the best surgery, it won't cure. But you learn how to live with it. And once you learn how to manage, there are moments when you don't even feel any pain. And the pain just progresses when you do what you're not supposed to do. So we learn how to live with it like any other chronic problem. Yeah.
Julie, you seem to be a young girl. Has endometriosis affected your social life? Have you lost some friends? Tell us, have you lost some friends because of this? Have you lost a job? Tell us, how has it affected your social life? Because today is about stories of endometriosis, yes.
Yeah. So for
Um,
me, I just want to open up.
Hmm.
Okay. Hope you can hear me. So for me, I used not to open up because uh, the experience I got from my relatives, I thought even my friends will not even understand this. Because I opened up to one friend and she was like, "Oh, what's that?" So they used to scare me. So I left it to myself. So I was fighting the battle alone, plus maybe my God. So I used not to talk it out to the people, to
Ah,
my friends.
yes, Julie, you're talking about friends. Let us talk about life beyond friends, like
I
in
can't
relationship.
hear you.
Oh, you can't hear me?
I can't hear you.
Oh, can the rest of you hear me? Stella, can you hear me?
Yes, me can hear you.
Yeah.
Okay.
Yes, I can hear you, please.
Julie, can you hear me now? Okay. Julie can't hear me. I really felt Julie, can you hear me? Okay. I'll get back to Julie. Fina, as you a person dealing with from your perspective as a medical nurse dealing with endometriosis, do you have some training opportunities for people that want to come to the foundation and learn about the management of this condition? You're muted.
About the training,
Yeah.
muting the device. About the training, we are planning, we've so far partnered with some hospitals and carried out sonographic training. So we are planning to train sonographers and radiographers about how to diagnose endometriosis. But above all, we are training people, whoever is willing to become an advocate of endometriosis or a warrior, an endometriosis warrior themselves. We train them about endometriosis, the signs and symptoms, how to manage these ladies, and all that. So we give them the skills so that we send out people to really advocate for this condition, so that we try to get the different women that are suffering out there. And we call upon still everyone who is out there, if you would wish to become an advocate of endometriosis, you're most welcome. We give you the skills, we tell you the basic information you need to know, so that if you are a nurse, or even if you're not a nurse, if someone shares with you about endometriosis, you can know and then refer that client to us, and then we do the other tests that so that we can confirm the condition. Actually, I didn't mention, but I myself, yes, I'm a nurse, but I'm also an animator. One of the things that really brought me into animation was that I really wanted to create awareness about endometriosis. So when I say I'm really a strong advocate, it is serious. So I have a number of animations that I've animated about endometriosis, and they are free. They are they are free to share. You can find them on our socials, and yeah, I can share with you so that you can share with
Yes,
your friends and everyone.
in fact, you shared some with me, only that it was long. It was 7 minutes. I would have loved actually to be playing them immediately. So I kind of ask you, Madam Animator, to make me some that are about 1 minute, 1.5, so that we can be playing them. Otherwise, thank you so much. And again, what Fina is saying that for us to be part of this movement of endometriosis, we all don't need to have endometriosis. No. But if she can do animation and I can host them, another person could write about them in a story in a newspaper. So we all do different things, but together we create a community that is accepting. I had my first discussion about autism a few months back, and on the 2nd of April, they are going to do the first autism exhibition in the country. And I'm so proud and happy about that, that at least I hosted them, and now they are doing something. I also plan or want to have a day where we shall have an exhibition about endometriosis. And I promise I'll travel all the way from the US to Uganda attend that, because I want to be part of this movement. And to colleagues watching in there, I mean, what is your contribution to human life? Ask yourself that. Whatever skill you have, God gave it to you. There are people who are good in cartoons. Can you use your cartoons to talk about endometriosis? There are people who are good in singing. Can you compose songs about endometriosis? Can we use everything you have to serve human life? Again, ladies, I want to ask you, let's agree next Sunday, same time, 9:30, to be here and continue this conversation. But I had one personal question to Julie. Julie, come back here. Julie, let's talk about relationship, boyfriends and girlfriend. Have you met someone that you've told about your condition? This is personal, and they agree to stay with you.
And when I come, my voice disappears.
No, we can hear you, Julie. Don't run away from my question. Julie, unmute, unmute. Yes, we can hear you very well. Can you hear me? Okay. Julie will answer that question next week, I think. Sorry. To Madam CEO, let me conclude. I'll basically go back to everyone to give me their closing remarks. But in a minute or two, to tell me about Endometriosis Foundation of Uganda and what you do, where you're found. And next week, we want to deal more about this foundation, and we are going to discover more about it. We are going to, in a nutshell, to talk more about it. But today, in a nutshell, tell us what Endometriosis Foundation Uganda means, where they are found, and what they do. You're muted. Okay.
Yeah, Endometriosis Foundation Uganda is a non-profit organization with a main office. We have an office in Rengo district, and we have a contact office in Entebbe along Garuga Road. So Endometriosis Foundation Uganda stands to sensitize the general public and medical professionals about endometriosis, supporting women battling the disease, and linkage to the right health professionals that can handle the disease. Offering entrepreneurship skilling to our sisters that have the disease. So 2 years back, we also came up with a Pan-African Holistic Endometriosis Wellness Organization that is based in Garuga, Entebbe. And the aim of this is to support all Africans, all ladies along Africa and beyond. This is a holistic center that is ready to support women battling endometriosis and adenomyosis. Endometriosis is a chronic disease that even up to date has no known cure, but we can live with it like any other chronic disease, like diabetes, hypertension, sickle cell, and all that. So we also have therapies that we must make sure we learn and then manage the condition. And these are the key. Actually, to us, sometimes someone was trying to inquire or ask, how do we manage? So once someone is detected early, we train you on how you can manage to manage the symptoms without using drugs. So if it's advanced, let me say those people that are detected late, sometimes surgery is needed, but not everyone can perform this surgery. So we link you to the right professionals that at least we say with endometriosis, the first surgery should handle someone and manage, should make you feel better. So not the first surgery to make the situation worse. You've seen all these cases. So we link you to the health professionals that we believe will do good work so that this first surgery possibly could be the last surgery. You've heard some of the ladies mention they have 5, 6 surgeries and all that, just because maybe she had the first or the initial surgeries, someone would open and close. So we say as an organization, we work with specialists that we believe won't handle, and then you have complications. So you realize that if someone is handled and then multiple surgeries are done, it will also become hard for someone who will come in. So we do support our sisters, psychological support, managing stress, the stigma around it. Once you get to know you're not alone, we have group sessions. We do offer support, let me say financial, wherever we have. So that's why we call upon the public Our lovely government, the Ministry of Health, yes, we appreciate the fact that they are coming up to give us a hand, but we need more financial support. We are many and we can't handle all the ladies financially. You realize that to many of us, the workers, maybe those that have worked, and sometimes you can't proceed, but the people who have NSSF funds. So if at all we recognize this condition, these are women that battle fertility and all that. If we could access that finance or that money, it will be a good help to this person who, if possibly they had some money, could be able to have children. It doesn't matter how they've had them, but that money would help. Instead of waiting for me to get old, I can access that money. So we are trying to advocate for this condition, and we believe together as a country we shall save our sisters. The Pan-African Holistic Endometriosis Wellness Center is open. We can Google the Endometriosis Foundation Uganda. We are always on Twitter, Instagram, and our contacts. Yeah, you can reach out to, I don't know if I can share. So 0787714612, or you can call 07681666133. So you can reach out to us, fellow dear ladies with endometriosis. Never suffer in silence. We are here to support each other, and we are always strengthened by each other. Yeah.
Again, thank you so much, ladies. Do we promise to be here next Sunday at 9:30, please? Yeah, we can continue this conversation. But Julie, I had your question before you ran away. Can you hear me now?
I can hear you.
Good. I was asking, beyond the menstrual issues that the pain, has this condition affected any of your relationships? Like people coming to know this and they run away?
No,
Good.
no. The person I've got, they have really been supportive.
Thank you
Maybe we
so
have
much.
separated because of other issues, but the condition, they have been supportive and even looking for help. For the past years, they are looking for help
Okay.
because for them,
Yeah.
they thought, yeah.
Okay. That is very good. Tell whoever that man that a man Jenko came, I'll send him one chicken for just being a gentleman. Because I mean, yeah, that's how men should behave. That's how men should behave. Closing remarks, Stella. Stella, as we wind up today's program, what's your call to people watching in? What's your call to government? What's your call to fellow women there who may be suffering in silence? What's your last minute? And then you also send regards to your family, and we shall go to another person and close. Yes, Stella. I think you muted yourself. Stella, you muted yourself?
No.
Okay. Yes,
Are you
we hear you
getting
now.
me?
Yes, we can hear you now.
Okay, my humble appeal first is to the government, as in the government should come in and give us a hand. First of all, the organization as the Endometriosis Foundation Uganda, we are very many. On top of being very many, the organization can't handle it alone. It needs a government hand. Because the medication itself, it is very expensive, the surgeries are very expensive, the hormones are very expensive, and the insurance companies do not allow. Second, to the families shouldn't take it as witchcraft. Some of them over ask us questions that we can't answer. Where did you get it from? Why you? Why not us? As we've never heard of it. Those are some of the questions that have been getting from my relatives. Then 3, to the parents. This is my humble appeal to the parents. They should closely go hand in hand with their girls. They should be friends so that they get to know what they are going through. Because failure to know or failure to become a friend with your child, the child will go silently. And it is better to be handled when it is still at an early stage than when it is late like me. Then to the organization, I'm so humbled to thank the Endometriosis Foundation Uganda, Miss Grace's family that came in. It is a miracle to some of us. It is a miracle to the entire Uganda. Because if it wasn't Grace, I think it wouldn't have known to the entire country. But through Grace and the family being like most of the family members are medical workers, and the passion they have, the love, at least they have welcomed us. You may think we are family members. They have loved us that much. If Uganda and the government can come in as Grace's family, I think we can push the thing and it will go on.
Thank you so much, Stella, for that. And we hope to see you around next week on Sunday as we continue this discussion. It's everyone adding a voice. You see, the testimony that the ladies are giving just because of one family of Grace coming out to stand up against. Imagine if 20 families did that. Imagine if the government did that. I've seen government of Uganda give money to bloggers, to people, to YouTubers, whose content, if you you looked out for, these are people that are spreading either rumors and so many things, but I don't want to go there. So to me, I think they are genuine people that could benefit from this such funds. Imagine you give 5 billion shillings to such organization, how many lives are going to be transformed? So to me, it is not that we don't have the money as government, it is where we want to spend the money. And I want to believe that this is one group where Ugandan taxpayers' money can be, rightly spent. Yes, Afina, as you conclude this, what are your last remarks here?
Thank you so much. My last remarks. First, it's a humble appeal to the government. We are developing a course as Endo Uganda that is going to train people about endometriosis, the science, the management, and all these things that we are talking about. So my humble appeal is that the government will look into it and consider this course to be taught in medical schools and even in other schools, so that people can become aware about this condition as early as possible. And then to the general public, I would really say to you all, this lady's
Mm,
pain is not fake. It is real. We
mm,
actually call it an invisible disability.
mm,
Endometriosis is actually an invisible, because if a lady is in this pain, there are lots of things she cannot do, however much she wants to. Some cannot
mm,
even go to school. Some have dropped out of school because of endo. Some
mm,
cannot work, even carry a certain thing. So this pain is real. Let us please
mm.
support these ladies. Let's be there for them and understand them. Yeah. Thank you.
Thank you so much, Fiona. Again, I want to ask to thank the people that are watching in live and the interaction that we've had in the comment section. Thank you so much. But one last thing I want to ask all of you is to subscribe. 60, almost now 60. It was 90, but it has now gone down to 65. People watching this page do not subscribe. Now, when you subscribe, you tell YouTube to send this. So I'll first ask all my panelists today, Fina, Julie, Stella, Grace, please subscribe to this YouTube immediately. Yeah, each time you subscribe, YouTube sends it further. We want this message to reach at least 20,000 people this week. That's the goal. If I can target 20,000 people in Uganda, that is enough information shared. So encourage, share in all your groups, share in all your churches. Churches, can you play some of these messages in your churches to your young people or to the women? Churches sometimes have contacted me, oh, we want to host you. And what I always do, I just send them such videos. I tell them, you know what you people need to do is to listen to this endometriosis. Imagine churches play this on the women. You have women Sundays. Imagine you call your women in church and you play this information. It is not obscene. It is rich. It is informational. I think here we shall help to pass this information around. Yes, Grace. As we finish this, what is your closing remarks for this program today?
My closing remarks goes to the parents. Yeah, I also add my voice to Stella. To our dear parents, let's monitor our young girls. We are standing here, or we always speak about this because we don't want our sisters to go through what we went through. So monitor your child. Once you realize the child has chronic period pain that is progressing from 1 month, more than 2 months, 3 months, the child has the premenstrual cramps, and this progressively keeps affecting your child. Please don't take it normal. If your child bleeds more than normal, more than 4 days, please, it's not normal. Let's also monitor those young girls that go to school and request for more packets of pads. Kindly monitor that child. The dear workers, the people we work for, the employers, kindly. I think we shall also get to a stage where the government will possibly allow menstrual leave. If maybe your employee has pain, at least they can be granted 2 days off work. So I think we should really advocate for that. Yes, some countries have recognized this, and I believe we shall get to that step. To the Ministry of Health, we appreciate the fact that you're coming up, and we believe we shall move a big mile. So to the government, we are many ladies on the support group. We can't support them alone. We really need your support. We need more funds to support these ladies. Kindly, we request for your help. And to the public, whoever is listening in, endometriosis compromises the whole quality of a woman. This pain is real. These ladies go through hell. So let's embrace them. Let's support them wherever they are. To the men out there, it could be your sister, it could be your wife. Kindly be patient with them and show them the love. Because it's really hard for someone to grow up in pain, and along the way, they are not given that love. So that's why, as a foundation, we take them as sisters. Yes, if someone is not understood, we shall understand them. Let's all stand together to support women battling endometriosis. We are always open. If you have a school, kindly reach out to us. We offer trainings. We do raise awareness in schools, hospitals, to the churches. Kindly reach out to us. We can come to your churches, we can come to your schools, universities, and all that. To the medical professionals, we do come to hospitals and train our dear doctors. We believe when you listen to our sessions, you pick something. So thank you so much, Richard, for this opportunity. Thanks for amplifying our voice. Yeah.
Okay, as we come to the end of this conversation and discussion, one thing is clear: endometriosis is real. Endometriosis is real. It doesn't check between skin colors. It doesn't check between tribes. It's real. It's painful, and actually it deserves more attention. I've not been moved by so many conversations on this channel like I always do when it comes to endometriosis. These are innocent women, young ladies, and girls that were just born like this. Stop discriminating against them. Stop stigmatizing them. None of them did anything wrong about this whole thing. No woman should have to suffer anymore in silence, and no pain, this pain should not be normalized. Let's stop telling women, oh, menstrual pain is normal without understanding its cause. Today's conversation is not just about awareness, it's about action, empathy, and change. Everyone watching in today, the different stakeholders, we need to be more empathetic. We need to be more accepting to these people. We need to accept the way they are. She has talked about menstrual leave. What would the company leave if you granted Stella 2 days of leave because she can't bear the pain? To the men listening in, if you have a wife that is suffering from such or undergoing this period, please understand them and support them. It's not their making. It's not because they did anything wrong. It's not because they did an abortion. It's not because they took family planning pills or any herbal medicine. This is a medical condition. Just like you're born with a sickle cell, just like you're born with a heart problem, just like you're born with any other health issue. We thank Endometriosis Foundation Uganda for this incredible work that you're doing and for standing up to these ladies. And we want to promise as a self-care initiative that we are going to work with you until every woman in all corners of Uganda hear about this condition. We welcome you to this page every Sunday, 9:30, each time you have something to pass out. We shall be part of your function. We shall be part of your campaign. We shall be part of your movements. And we can't wait for you to have a run called the Endometriosis Run Uganda, where we shall come and be run, we shall come and make noise, we shall come with Vuvuzela to make sure everyone hears about this. Again, to people who think you're so far away from this condition, no. You're just one birth away from of a baby girl, and at age 12 or 13, when they start their periods, you realize they have a condition. So the earlier we make noise, the earlier we create an accepting, understanding, and informed society about this condition, the better we deal with them. And we want to encourage everyone watching to continue this conversation, to support those affected, to help break the stigma once and for all. Because every voice matters and every woman's pain deserves to be heard. I want to thank you for watching and listening in today. I kindly ask you to subscribe to this page because then we are giving YouTube a chance to actually continue sharing such message to all the people on YouTube world over. I want to call my friends, my partners, financial partners, people with financial muscle. These are organizations worth spending your money on. Yes, look out to this organization and let's support them. Endometriosis Foundation is Uganda, go on your website, go on all social media handles and support them. Again, I want to invite anyone willing, any of you willing to join me. I have TikTok live every Thursday. I would be happy to have one of you come and also talk to, I'm normal, I have close to 1,000 people watching in live. So I'll be happy if I have one of you. I will work with Grace to send me someone on Thursday to have this conversation. And this is one way we are going to create awareness beyond this YouTube. I have X discussions on X. I have discussions on TikTok. I have discussions on YouTube. And everywhere I go, to me, mine is about prevention of diseases and creation of awareness about these diseases. I'll be happy to have one of you come join me on either X. It doesn't have to be a video. It is going to be an audio, and we continue this. This is one we want to kuamba the entire media with information about endometriosis, and that's one way we are going to be able to get the support we need to drive the awareness we have, but also to stop the stigma and to encourage the young girls suffering out there to come out and speak about this. I want to thank you for your time. My name again is Mr. Selfcare from Mr. Selfcare Studios. Wherever part of the world you're watching this from, thank you so much for being part of this wonderful audience. And until next time on Sunday, 9:30 p.m., today we had our broadcast from our studios in the US. Thank you so much. Stay blessed. Happy Easter week and have the rest of your Sunday and a blessed new week to come. Bye.
Bye.
Mhm.